Here is a detailed explanation of pancreatic juice, covering its composition, functions, and the regulation of pancreatic secretion in depth. Pancreatic juice. Pancreatic juice is an essential digestive secretion produced by the exocrine pancreas. It plays a critical role in the chemical digestion of food in the small intestine, particularly in the duodenum. Composition of pancreatic juice. Pancreatic juice is a clear, alkaline fluid, pH 7.8 to 8.4, secreted in response to the presence of food in the small intestine. It consists of enzymatic and aqueous electrolyte components. A. Enzymatic component secreted by acinar cells. These enzymes are responsible for digesting all three major nutrients: proteins, carbohydrates, and lipids, as well as nucleic acids. 1. Proteolytic enzymes. Protein-digesting enzymes, trypsinogen, inactive precursor of trypsin, activated by enterokinase in the small intestine to trypsin, which in turn activates other zymogens. Chymotrypsinogen, activated by trypsin into chymotrypsin. Procarboxypeptidase, activated to carboxypeptidase, breaks terminal peptide bonds. Proelastase, activated to elastase, breaks down elastin. All proteolytic enzymes are secreted as inactive zymogens to prevent autodigestion of pancreatic tissue. 2. Amylolytic enzyme. Pancreatic amylase breaks down complex carbohydrates, starches, into disaccharides like maltose. 3. Lipolytic enzymes. Pancreatic lipase breaks triglycerides into monoglycerides and free fatty acids. Phospholipase A2 acts on phospholipids, e.g. lecithin. Cholesterol esterase breaks down cholesterol esters. 4. Nucleolytic enzymes. Ribonuclease RNase digests RNA. Deoxyribonuclease digests DNA. B. Aqueous component, secreted by ductal epithelial cells. This component makes up the bulk of pancreatic juice and is rich in bicarbonate ions HCO3-. Bicarbonate, HCO3-, neutralizes acidic chyme entering from the stomach and provides a suitable pH for enzymatic activity. Water helps in dilution and transport of enzymes. Electrolytes, sodium, Na+, potassium, K, chloride, Cl-, calcium, C aqueous wine. Neutralizations of pancreatic juice deneutralizes HCl, digestive enzyme activity, breaks down carbohydrates, proteins, fats, and nucleic acids. Neutralization of gastric acid. Bicarbonate neutralizes HCl, protecting intestinal mucosa. Optimal pH for enzyme activity. Enzymes such as trypsin and lipase work best in alkaline conditions. Activation of zymogens, trypsinogen trypsin by enterokinase, then activates other enzymes. Prevention of autodigestion. Enzymes secreted in inactive form, zymogens, to avoid digestion of pancreas. 3. Regulation of pancreatic secretion. Pancreatic secretion is controlled by neural and hormonal mechanisms and occurs in 3 distinct phases. 1. Cephalic phase, 20%, trigger, sight, smell, thought, or taste of food. Mechanism, stimulated by the vagus nerve, parasympathetic system. Acetylcholine stimulates acinar cells to release digestive enzymes. Secretion, enzyme-rich, low volume. 2. Gastric phase, 5 to 10%, trigger, distension of the stomach and protein digestion products. Mechanism, mediated by vagovagal reflexes. Gastrin from G cells of the stomach may stimulate pancreatic acinar cells, minor role. Secretion, moderate enzyme secretion. 3. Intestinal phase, 70 to 80%, important trigger, entry of acidic chyme, fatty acids, and amino acids into the duodenum. Mechanism, secretin from S cells in the duodenum, released in response to acidic pH 4.5, stimulates ductal cells to release bicarbonate-rich fluid. Cholecystokinin, CCK, from I cells in duodenum and jejunum, released in response to fats and proteins in chyme. Stimulates acinar cells to secrete enzyme-rich pancreatic juice. Secretion large volume, bicarbonate and enzyme-rich. Neural control. Parasympathetic stimulation via the vagus nerve enhances the action of secretin and CCK. Summary table. Hormonal regulation. Hormone secreted by stimulus, effect on pancreas, enzyme-rich juice from acinars, secreting duodenal S cells, acidic chyme, low pH, bicarbonate-rich juice from duct cells. CCK, duodenal I cells, fatty acids, amino acids, enzyme-rich juice from acinar cells, gastrin, gastric G cells, gastric distension peptides, mild stimulation of enzyme secretion, vagal, vagus nerve, cephalic and gastric stimuli, enzyme secretion via muscarinic receptors. Clinical relevance: pancreatitis, inflammation due to premature activation of pancreatic enzymes. Cystic fibrosis, defective chloride channels, CFTR, affect pancreatic juice composition. Pancreatic insufficiency leads to malabsorption, steatorrhea, weight loss. Here is a flowchart summarizing the composition, functions, and regulation of pancreatic juice. Flowchart: pancreatic juice overview. Plain text: pancreatic juice. NAPI composition. Enzymatic part. Enzymatic part, aqueous part. Electrolytes, acinar cells. NMI, K-pies, Cl-meters, HCO3 proteases, zymogens. Bicarbonate, alkaline pH, amylase, water, lipase, nucleases. Functions: digest proteins, carbs, fats, nucleic acids. Neutralize gastric acid, HCO-mens, maintain alkaline pH for enzyme activity, prevent autodigestion, inactive zymogens. Regulation of secretion. Cephalic phase, gastric phase, intestinal phase, vagal stimulation, gastrin, vagus secretin, HCO3 enzymes, CCK, enzymes, legend, trypsinogen, chymotrypsinogen, procarboxypeptidase, digest proteins, lipase, digests fats, amylase, digests carbohydrates, nucleases, digest DNA and RNA, secretin stimulates bicarbonate from ducts, CCK stimulates enzyme secretion from acini, vagus nerve stimulates both components. Here are Schotch 10 applications and implications of pancreatic juice to nursing practice. No explanation as requested. 1. Monitoring for signs of pancreatitis. 2. Administering pancreatic enzyme replacement therapy. 3. Educating patients on low-fat diets in pancreatic insufficiency. 4. Assessing for malabsorption syndromes. 5. Recognizing steatorrhea as a symptom of enzyme deficiency. 6. Monitoring serum amylase and lipase levels. 7. Preparing patients for pancreatic function tests. 8. Providing care for patients with cystic fibrosis. 9. Assisting in the management of chronic pancreatitis. 10. Identifying complications from pancreatic cancer or surgery. Thank you. Have a nice day.